When you see this after you've done an implant several weeks later, it's extremely frustrating, and you wonder what happened. And at the time of implant, you tugged on the leads and they seemed to do just fine, but now you have this situation where the leads are pulled back. To pass the tug test at the time of implant, the muscle must be compressed by the suture against the suture sleeve, which results in necrosis of the muscle. And why that's important is that as the muscle turns to scar tissue, it shrinks. And so that you end up with a suture sleeve that is loose. Now, this doesn't often make a difference, but in some patients, especially if they fiddle with their pacemaker a little bit or other circumstances, then you have a loose suture sleeve and the lead can slide in and out. So how do you stop this from happening? There's a process called tying to the knot. And rather than tying directly to the muscle, you make your first bite into the muscle, and then you tie the knot here. And there's two things. One is the knot doesn't need to be tight to compress the suture sleeve. It just has to be tight enough that you have a nice tight knot in the muscle. And then step two is to then wrap the suture around the suture sleeve. And to pass the tug test with this approach, the suture is tightened not against the muscle, but against this knot. That there's less likely for the muscle to undergo necrosis. However, even if it does undergo necrosis and turn to fibrous tissue, it really doesn't matter. So here we have a circumstance where the muscle turned to fibrous tissue, it shrunk, and now it's a little bit loose in here, but the suture sleeve, which is tied directly to the knot, is still tight on the lead, and it's not going to pull loose. So this may move a couple of millimeters back and forth, but it remains tight here. So I hope you find this useful. I know it's a lot of places that are trained to tie directly to the muscle, but I think that if you do that, this will eventually happen to you, and the way to prevent it is to tie to the knot. Thank you for your interest.